And out to Borno State, where about 1,000 returnees of Gwoza local council areas of the state of Borno State have benefited from a medical outreach meant to improve their health condition. The gestures aimed at bringing succor to survivors of the 13 years Boko Haram crisis. Senior reporter Jessica Fida reports.
Another day for returnees of Gwoza local council to go out in search for daily bread. Most of them have started to pick up pieces of their lives. Today, it's not just like any other day, as a group is here with good tidings. Gwoza Elite Forum has brought a free medical outreach for the returnees. 75-year-old Luka Girda is among the lucky ones to be diagnosed free of charge. He says, "This is not the first time I have benefited from the Gwoza Elite Forum's gesture. They have been wonderful in taking care of our health needs and other assistance." The Gwoza Elite Forum's objectives of reaching out to the returnees of their hometown is part of their social responsibility.
We are coming to support what government is doing. Government cannot do it all alone. The local government, the state and the federal. So we, the individuals in our various places of work, we need to join hands and come with any assistance that we will do to support our people, to support our locality, to support the government, so that we'll bring development, we'll bring progress for our own dear local government. By doing that, you can see there's going to be a peaceful coexistence, a development that we desired and then we've been expecting from other places.
So I think we removed over 5 hernias. We did a lot of hydrocelectomies. We did a cesarean section. We did 3 appendectomies. We did a total vaginal hysterectomy, a total abdominal hysterectomy, and quite a number of surgeries.
Survivors of a 13-year conflict in Borno continue to have healthcare challenges, and having such a program available would go a long way in addressing their needs. The returnees also benefited from clothing materials for the young and old. Jessica Fida, TVC News, Gwoza.
Jesse joins me now for more on this story. What's life like for the returnees in Gwoza, Jesse?
Nifemi, Gwoza, everybody knows that it's one of the worst hit local council areas in Borno State. You know, sometime in 2014, the town was declared under Boko Haram siege, and Boko Haram stayed in that local council area for about a year. Before 2015, you know, two months before the election, then the Nigerian army recaptured the town. But people are back and they are starting to pick up the pieces of their lives. You could see that, you know, they're trying to make some handiworks, to earn a living. Development partners and the state government are doing their best to see that the people, you know, have turned a new leaf and start afresh. You know, life is not very much easy for them because they've been away for a long time. They've been in IDP council, and now that they're back, they're trying their best to see they could cope. But just as you've seen in the report, there are a lot of health challenges in that area. Although there are some healthcare facilities established by government and UN agencies, yet this the health facilities are not enough. You know, we have influx of people going back to their homes. Most cases of health issues they have there, you know, high blood pressure, people thinking about their lives before and then now they're starting something afresh. You know, it's a bit of concern to them. But, you know, generally they've started well, though it's not easy, but they're doing very well.
It's hard to tell how sustainable these humanitarian aids are and how well government is also doing to ensure that life is better for these ones. But what can you tell as regards the community itself, as regards security infrastructure to ensure that what happened before doesn't repeat itself?
Well, it's a very good thing to note that security situation has marginally improved in that axis. You know, for the, let's say, 5-6 years ago, you cannot go to Gwoza, you cannot go to Puka. And don't forget that Gwoza is one of the routes that will link Borno State to Adamawa State, through Konduga, Bama, then Gwoza, and it links you to Askira and then Adamawa State. It's one of the worst routes. You cannot follow that route because insurgents are out, kidnapping people and then killing people. But dark times are over. Security has improved, the Nigerian military and all security forces are doing their best to ensure that lives and property are being safeguarded. And when we went to Gwoza, we saw that a lot of people are going about their normal businesses, but there are, little pockets of attacks, one or two, because in Gwoza, there are Mandra Mountains where it has been said that some of the insurgents, are hiding under the mountains. But the security situation has improved. Now, talking about the healthcare intervention today that you saw, a lot of aged people there are needing support, healthcare support, and the Elite Forum are people from the community. They deemed it fit to take this humanitarian, assistance to their own people. They said the government is doing its best. Development partners are doing their best, but we can do it also as the indigenous of the place, and that is why they didn't fit to take this humanitarian aid, that's the medical outreach, to the people. And the people are happy. The people are so much excited that their people are not giving it back to the society to ensure that they are being taken care of.
Yes, it's a feeder live for us in Maiduguri. Thank you for the updates there.